What actually is dementia? Hi, I'm Dr. Knight, a geriatric and general internal medical registrar, and this is Getting On, the series where we try and stop worrying about getting old and just start getting on. Welcome to our series on memory, and today's episode we're looking into what actually is dementia. Dementia, I think, is a term that gets bandied around quite a lot and is used just for anyone who has any kind of memory loss. But I think we get a bit confused and we use the term incorrectly a lot of the time. So I'm going to try and unpick what dementia is for you today. The resources I'll be using today are the Alzheimer Society UK website and also the NHS website. So if you're interested, please do go and take a look, especially the Alzheimer's UK website. It's a really amazing tool and has lots of information on there for you. What is dementia? Dementia is actually a set of symptoms. It's not a disease within itself, but it is caused by diseases that affect the brain. So the most common disease that causes dementia is Alzheimer's disease, which a lot of us have probably heard of before. Now, I think people get quite confused and think that all dementia is Alzheimer's, but that's just not the case. Dementia does not mean Alzheimer's. Alzheimer's is one disease of many that can cause dementia. And I'll try and unpick that a bit more for you in today's video. Let's talk about the symptoms of dementia to begin with. I think most of us, when we think about dementia, know the main symptom, which is memory loss. So that's memory loss that's more than just sort of forgetting your keys once or twice, maybe forgetting people's names or forgetting the occasional birthday. It's memory problems that include forgetting things that you've only just been told or something you've been told repeatedly, or putting things in really unusual places, like putting your keys in the bathroom sink. Or it might be that you're just really struggling to learn new tasks that you previously would have been able to learn. So memory loss tends to be one of the main symptoms. But another big symptom is confusion and not being able to fulfill your daily tasks. So for example, you might not be able to plan your route to a new location, or you might find yourself getting a bit muddled when you're getting the bus to work. You might suddenly forget which stop you're meant to get off at. So it's kind of more significant confusion and struggling with daily things that you used to be quite good at doing. Another symptom might be difficulties with language and understanding. So although it's quite normal every now and then to sort of forget a word when you're having a conversation, it's not normal to repeatedly not be able to follow a conversation with someone or start talking to someone and then forget halfway through speaking what you were actually talking about in the first place. So they're more sort of sinister signs of dementia rather than normal aging and memory loss. Another symptom people with dementia might experience are changes in their mood and their personality and behaviour. And actually it's quite common for people to experience feelings such as getting anxious really quickly, maybe becoming angry and frustrated when they normally wouldn't have in that situation, or being irritable or sometimes quite withdrawn and becoming more isolated. As you can see, dementia actually encompasses a whole range of different symptoms. It's not just memory loss, which I think is a bit of a misconception about dementia. And as you will see in this video, there are lots of different types of dementia, and dementia actually affects people in lots of different ways. So one person might have more memory loss, another person might experience more change in their personality. It's a real mix of things. Other key features of dementia are that it progressively gets worse with time and that it affects your daily living. So some people can have a little bit of memory loss or some of the symptoms I've described above, and it doesn't affect them at all, and it doesn't affect their daily lives or their independence. So that wouldn't be clarified as dementia. Now, it's important to remember that actually a lot of the time you yourself aren't able to pick up on these signs of dementia, and a lot of the times it's our loved ones or work colleagues who might be the ones to mention to us that they notice some changes about us. So it's really important to, if people are worried about you and coming to you with these symptoms that they've noticed, to really listen to them and maybe at that point consider speaking to your GP. So who gets dementia? Currently, we estimate around 1 million people in the UK living with dementia. It mainly affects those people who are over 65 years old, and about 1 in 4 people over the age of 65 might have dementia. So why do we get it? It's important to remember that dementia is not a natural part of aging. Just because you're old does not mean you will get dementia. Some memory changes are of course normal as we get older. So as mentioned before, occasionally forgetting your keys, forgetting people's names, that's called age-related memory impairment. And that's perfectly normal as our brains get a bit slower with our processing as we get older. But dementia is more advanced changes to the brain caused when a disease damages nerve cells in the brain. These nerve cells carry messages to different parts of the brain, and the more of these nerve cells damage, the less the brain is able to function properly, leading to those symptoms that we've just described. Now, although dementia isn't an expected part of aging, the risk does go up as you age. And that's simply because as we get older, there's just a longer amount of time for that underlying disease to cause damage to the brain. Who gets dementia? We've touched on this a little bit, and I just want to reiterate the fact that dementia is not a normal part of aging. So not everyone getting old will get dementia. It's not always clear why some people get dementia and some people don't, and that's because it tends to be a combination of lots of different things in our lives and in our bodies. Most dementia is not inherited, so just because a parent has it doesn't mean that you will have dementia. Things that we do know that contribute to getting dementia that we've already mentioned include high blood pressure, smoking, drinking more alcohol, having a poor diet, not doing any exercise, amongst many other things. These can all increase your risk of getting dementia. The good news is that evidence shows that we can actually reduce our risk of getting dementia. So it's important to be really healthy throughout our whole adult lives, but in particular between the ages of 40 and 65, that is when having a really healthy lifestyle can help reduce the risk of getting dementia. Having said that, if you're older than 65 or if you're younger than 40, it's still really important to have a healthy lifestyle because at any age you can influence your brain. I'll do another video about what we can do to help reduce the risk of dementia, so keep an eye out for that. How do we get diagnosed with memory impairment or with dementia? If you've noticed that you have memory loss that is starting to affect your daily activities or affect you on a regular basis, or your loved ones have noticed that you start to have some memory problems, then the first person to talk to would be your GP or your main healthcare professional. It's really important to not diagnose yourself. I know it's really easy to watch videos like this or Google symptoms of memory loss and think, okay, I've got dementia, that's it now. It's really important not to do that. So please go and speak to your GP if you have any concerns about anything that we've touched on in this video today. Are there any treatments? Well, there currently isn't any cure for dementia of any type. Depending on which type of dementia it is, there are definitely things we can do to slow down the process or to help with the symptoms. So to sum up, dementia isn't a disease in itself. It is caused by other diseases, and it's a collection of symptoms including memory loss, confusion, difficulty in language and understanding, and change in behaviour or mood. Dementia is not a natural part of aging, and not everyone that gets old will get dementia. Although for some people, unfortunately, dementia is inevitable, there are definitely things that all of us can do to reduce our risk of getting dementia, and I'll address that in the rest of this memory series. In the rest of this series, we'll be looking at what to do if you're worried about your memory and how we can reduce the risk of getting dementia ourselves. Thanks for watching. There are 4 main types of dementia. Each type has slightly different symptoms, and to confuse things even more, a lot of them also overlap. Hi, I'm Dr. Knight, a geriatric and general internal medical registrar, and this is Getting On, the series where we try and stop worrying about getting old and just start getting on. Welcome to our series on memory. So the first main cause of dementia, as I mentioned before, is Alzheimer's dementia. So it's the most common type of dementia, and about 2/3 of people living with dementia will have Alzheimer's disease. It's caused by a buildup of amyloid or tau proteins, which are basically abnormal proteins that shouldn't be in the brain. These create lots of tiny sort of clumpy areas in the brain that we call plaques or tangles, and these affect how the brain cells function, and they damage normal, healthy brain cells. The most common early signs in people with Alzheimer's dementia are the classic memory loss or problem-solving difficulties or the ability to plan. Now, Alzheimer's disease itself has its own subtypes of Alzheimer's, which I won't go into, but each can present slightly differently, so can have slightly different symptoms. Things that put us at an increased risk of getting Alzheimer's dementia include age, just because with time we're just more likely to accumulate the likelihood of getting into certain disease, and sex. So actually being a woman makes you more likely to have Alzheimer's. But again, we think that tends to be because women live longer and therefore their likelihood of getting Alzheimer's disease within that time is increased compared to men. Our genetics also play a part. It's a little bit complicated, so there aren't really many genes that you can inherit. Will definitely get Alzheimer's, but we can inherit genes called risk genes, which can slightly increase our chance of getting Alzheimer's. So it's a bit complicated because the same gene in one person might not lead to dementia, but in another person, in a combination with different things, might lead to dementia. As always, lifestyle factors play a part. So whether you smoke, how much alcohol you drink, what you generally eat and drink, whether you do exercise, whether you have had multiple head injuries, if you've got different health conditions, all of these things in combination can potentially reduce or increase our risk of getting Alzheimer's dementia. And actually it's said that if we have a really healthy lifestyle, particularly between the ages of 40 to 65, that can really help lower our chances of getting Alzheimer's dementia. The second most common type of dementia is called vascular dementia. And this is caused by a reduced blood flow to the brain, either from strokes or from narrowing of the blood vessels. Common early signs of vascular dementia include difficulties in problem solving, problems with planning and organising, making decisions or solving problems. But again, just remember, different symptoms can occur in different dementias and they're different for different people. In vascular dementia, you tend to see this classic stepwise deterioration in brain function. And that's because each time a sort of vascular event happens in your brain, so a stroke or a clot, a small clot, you kind of get this sudden decrease in brain function, and then you'll stay stable for a while, and then another brain event will happen and you'll have another reduction in brain function. So it's called a stepwise reduction in your brain function. Now there are slightly different risk factors that cause vascular dementia as opposed to Alzheimer's disease, although there is quite a lot of overlap. The main one is that vascular disease really is about your vasculature and the health of your blood vessels and your heart. So if you have a cardiovascular condition, you are twice as likely to develop vascular dementia. Those kind of conditions include high blood pressure, diabetes, or having heart attacks or strokes before. So all of those lifestyle factors that we've mentioned, like whether you smoke, whether you have high blood pressure, whether you exercise, how you eat and drink, as you can imagine, they all have a really big impact and can influence your risk of having vascular dementia. The third kind of dementia I'm going to talk to you about is something called dementia with Lewy bodies, also called Lewy body disease, and it's really commonly associated with something called Parkinson's disease, which is a movement disorder. You don't have to worry too much about this, but basically is caused by different protein deposits called Lewy bodies in the nerve cells themselves, and that can lead to brain dysfunction. Slightly different and more subtle signs that you might experience with Lewy body dementia include difficulty in staying focused, experiencing hallucinations. Particularly you might also notice some problems with your movement, so slowing down of your movements, and also it tends to be associated with sleep problems as well. And then the last kind of dementia I'm going to talk to you about is something called frontotemporal dementia, or Pick's disease. Now, frontotemporal literally means that the disease is affecting the front and the temporal, so the front and the side parts of your brain. And again, this is due to an abnormal clumping of proteins in the wrong parts of your brain. Now, because of the areas it affects in your brain, the front and the side, you tend to notice more changes in personality and changes in behaviour as the most prominent symptom in this kind of dementia. You also tend to get it when you're younger. So we tend to diagnose Pick's disease in patients who are younger than 65 years old. So those are the four main types of dementia: Alzheimer's disease, vascular dementia, Lewy body dementia, and frontotemporal dementia. It's important to understand that sometimes you can have a mix or an overlap of dementia. So for example, you could have Alzheimer's disease with an element of vascular dementia as well, particularly if you have some of those more prominent cardiovascular risk factors. Dementia is not a natural part of aging, and not everyone that gets old will get dementia. Although for some people, unfortunately, dementia is inevitable, there are definitely things that all of us can do to reduce our risk of getting dementia. And I'll address that in the rest of this memory series. In the rest of the series, we'll be looking at what to do if you're worried about your memory and how we can reduce the risk of getting dementia ourselves. Thanks for watching.